Hello guys, Assalamu alaikum. Welcome to Revised Pathology once again, and today we are going to discuss on the topic atherosclerosis. So guys, let's see what is atherosclerosis. Atherosclerosis is nothing but hardening of medium and large sized arteries. Fine. It is nothing but the hardening of medium and large sized arteries is called as atherosclerosis. In short, the medium sized artery and the large sized artery, they lose their elasticity. Okay, that's called as atherosclerosis. Now, what are the etiology of atherosclerosis or the causes of atherosclerosis? Okay, that is smoking, diabetes mellitus, dyslipidemia, alcohol, stress, obesity, and hypertension. Let me repeat it once again. It is smoking, diabetes mellitus, dyslipidemia, alcohol, stress, obesity, and hypertension. These are all the contributing factors of atherosclerosis. Okay, now let's come to the types and the pathogenesis of atherosclerosis. So, guys, coming to the types and then the pathogenesis. The types of atherosclerosis are senile atherosclerosis, hypersensitive atherosclerosis, and Monkeberg's atherosclerosis. These are the three types of atherosclerosis, fine, or the classifications of atherosclerosis. Next, coming to the pathogenesis. The pathogenesis is very easy and very simple. First thing, what happens is endothelial injury, then comes platelet adhesion and monocyte migration, and the last happen is intimal smooth cell proliferation that helps in forming the atherosclerotic plaque. Okay, now let's come to the complications. So, guys, coming to the complication is the first complication that will occur is a myocardial ischemia. Next, ischemic heart disease, aneurysms, thrombosis, embolism, brain damage, cerebral hypoxia, and gangrene in lower extremities. So these are the complications. Now let's come to the clinical effect. So guys, the clinical effects will be narrowing of lumen, luminal occlusion, and propagation of plaque, atherosclerotic plaque. Okay, that will eventually lead to thrombosis and embolism, and even it can lead to even aneurysm. You can say the last one is even aneurysm that can lead to rupture. Okay, that will lead to rupture. So these are all the clinical effects. So we have been with the types, we have been with what atherosclerosis is, what are the complications, and what will be the clinical effects as well. So that's all for today, guys. Stay healthy and stay subscribed to Revised Pathology, and like, share, and comment on my videos. Till then, Allah Hafiz. Assalamu alaikum.